So, Dr. Kalinian, if there's talk to us a little bit about the difference between a suspected concussion. So, my daughter's out playing soccer. There's a header or there's a collision. We don't know exactly what happened, and that's a suspected concussion. And then how do we go from suspected to a diagnosed concussion?
Suspected concussion would occur obviously if you have you hit your head or you fall or you get a jolt. In terms of, that's the question of, is this a concussion or not? The point where it becomes a diagnosable concussion is when you start experiencing the symptoms. So just by having a jolt or
is a loss of consciousness necessary?
No.
No. So that is not necessarily an important thing to think about as a parent, I think, in deciding that if there's a suspected concussion, let's say in the game time decision, that athlete is pulled from the game, are we just waiting, playing the wait game until the symptoms, which we're going to talk about, until they appear? What are we looking for? Do we want to go to the emergency room right away? Or are there parents who are going to do that just to be a little more protective? Or what are the symptoms we are looking for that tell us that we should go get further assessed?
Well, the symptoms of concussion include disorientation, dizziness, loss of, say, awareness of where you are and what you're doing. So those are the actual symptoms, and then you start having the other symptoms that continue on, which will be dizziness, which will be sensitivity to light and noise. You become nauseous, and then later on, if nothing is done regarding those symptoms, typically should disappear, should resolve.
Within what period of time?
Typically they resolve within a few days, a few weeks. Sometimes it may even take a month.
So that's the question. If a concerned parent has a child who has a head injury in a game and no loss of consciousness, should they not get them scanned in the emergency room that day or even a few days? You're saying it's normal to have persistent symptoms.
Right, they shouldn't immediately run to the emergency room. It all also depends on the coach who is there. It's not as simple as, okay, because you're having a list of symptoms, that means it's severe enough for you to run to the hospital. Now, if your child starts experiencing severe headaches and complete change in personality and aggression and some mood swings, and the headaches will not go away with just simple over-the-counter medication for the headache, and they progressively get worse, I would say yes, run to the ER immediately, because that could be a sign of a bleed.
You're saying not going away, is that 2 days, 3 days, within the first day? Because again, as a parent, if there's nausea, if there's some kind of sensitivity to light, I would be concerned enough that I say, I don't 100% know what to do. They might not have seen this video, or they might not have had a conversation with you. So, can we come up with a more clear answer? Or is it going to be case by case?
It's case by case, and the important thing is to make sure that the athlete is pulled out of the game and does not go back, even during practice. So if they start experiencing the symptoms and it's during practice, do not go back and play.
Well, how do we distinguish that? I know there are certain, so we'll talk about the baseline concept, but if there is no baseline testing, and we're talking about why baseline testing is so important, that if there is no baseline, they get pulled from the game, they're a star player, or even if they're not a star player, it doesn't matter. The debate to go back in, what is the criteria if you're there on the sideline, which again, unfortunately you cannot be on every sideline, but if you were there, what is the criteria, or do we always err on the side of caution?
It's better to err on the side of caution than to let your child or the athlete go back and play prematurely when the brain has not healed yet.
But are there specific things without a baseline test that we can say, again, in my day, it was, can you name who this is? What city are we in? Who's the president? Those kinds of questions. Is that not enough? If you get the right answers on that, is that not enough to say you can go back in? Where's the gray area there?
So there is a quick test, sideline test, which includes questions such as, do you know who you are? Do you know where you are? Orientation. Do you know what game we're playing? If it's a game, do you know the name of the team? What was the last play that we did? Do you know what happened right before you fell?
So how many of those do they have to get right in order to go back in?
So it's a complete list of questions.
Is it 5, 10 questions? How many questions is it?
I would say it's probably about 20.
20.
And there are other things in there too.
Oh, wow.
And that's more of a sideline, paper questionnaires that it's usually administered by the coach or the athletic trainer who's on the sideline.
Mm-hmm.
Just like a quick thing. And if not, they're not
20
able
questions
to,
is not very quick. That's a lot of questions.
Well, one after another is who are you? Where are you? What's the name of the team? What was the last play? So you get a feeling of, if they start saying that, oh, I don't know who I am, I don't know where I am, you don't really need to continue on to the rest of the questions.
Right, but if they're getting a few right, wouldn't the same hold true, that if they get the first 4 or 5 right, shouldn't you be like, all right, they're okay? Or do you need to do all 20?
No, if you do have a concussion, you shouldn't be able to do well on the first few.
Right, so if you do the first few, then you're good, then you don't need to do all 20. More or less.
Yeah, more or less.
Right.
And, it's important to know that concussions are very unique per person. So not all concussions are the same. Not all the symptoms that a person is going to experience will be the same. So it's not as
Cut and dry
as black and white.
Gotcha. I'm gonna cut there.